So I just want to make sure that we know the ground rules. Ensure to mute your mic just in case you unmute and disturb the whole procession. Ensure that if you're in a public place or in a place that you can switch on your video, please keep your video off, but always check that your video is actually off and your mic is off. When you want to make a comment, please make use of the chat box. So the chat box is a very important tool for us, and we'll be able to check through in the chat box to see if there are any comments or any clarifications. I expect this session to actually garner a lot of questions around Smartcare because there are some colleagues, I'm sure, on the call that are not very conversant with Smartcare, which is really the electronic health record that the MOH is actually rolling out in all government facilities, but private facilities are also welcome to use the system. Riding on the digital health strategy that was launched in 2022, this is the digital health strategy from 2022 to 2026. The Ministry of Health has one vision, and really it's to improve health outcomes for all the Zambians through a sustainable, secure, and innovative digital ecosystem that is seamless in its operation. And today we want to get the updates, or especially on Smartcare Pro. Some of you may have used it, some of you are yet to use it. And I know many colleagues who think that Smartcare is really an ART tool. You only use it when you're seeing HIV clients or TB clients. But now I'm happy to inform you all that it's actually really robust. And there are so many modules, and you're able to use it in your OPD, you're able to use it in your specialized clinics. You're actually able to use it in theater, as we'll see from Dr. Sam. Dr. Sam, are you ready to do the presentation?
Hi, Dr. Maliro. Just confirm if my audio is good, but I'm good to go.
Your audio is good. Are you going to share from your end?
If you're able to share from your end, that would be very helpful. And then I can I'll be giving you the cue when I want to move to the next slide.
Okay. Let me just pull up the presentation. Dr. Sam, just confirm that you can actually see my screen.
Yes, it's visible.
All right. We're getting a little bit of an echo from where you are. Just ensure that the other devices are also muted.
Okay, just give me a second. All right, I think that should be better now.
Okay, so without further ado, dear network, I invite you to this Power Pack presentation. Please, let's stay tuned and let's focus and let's ask the questions that we need to ask. In fact, this is a Smartcare series. We're going to have today, we're looking at the updates, and next week we're going to be looking at some of the best practices. We'll get a facility that's been doing well and another facility that's been struggling, and then we'll compare and see where we can do better. So without further ado, I invite you, Dr. Msariri, to just take us through. You have about 30 minutes to go through this presentation. Then after that, we can have a discussion around the presentation itself. Dr. Sam, over to you. Thank you.
All right, thank you. Thank you so much, Dr. Malilwe, and thank you, colleagues. I just want to take special cognizance of everyone that has joined. We appreciate you making time because we know you all have very busy schedules. So just want to thank you all for clearing time in your schedule. As Dr. Malilwe has mentioned, this presentation will be focused on Smartcare Pro. We'll assume that there are people within the meeting that have, or at least never really used the system, because I'm sure by now everyone has heard of it. just so that we can cater for both audiences. So my name, by way of introduction, is Dr. Sam Sariri. I am the lead clinical business analyst for IHM, which is the current implementing partner for the ministry for Smartcare Pro. Next slide. Okay, great. So in terms of just an overview, as we thought through what people would want to hear, we did have a few thinking points just in terms of what have been the areas of interest in the past and going into a new financial year, what would people like to know? So we came up with this outline, starting with an introduction, just to give you an overview of obviously where we're coming from with regards to Smartcare, and to give you an overview of Smartcare itself, and also just give a snapshot of last financial year. And then also we know that there might be colleagues here coming from the M&D constituency or the data constituency. We want to be able to share with you some updates regarding data access, reporting, and the like. And then obviously what's in store for FY25. So we do expect that this will be a very well spent 1 hour, 30 minutes. And we intend to just bring you up to speed with some of the things which are upcoming. Next slide. So by way of introduction, I think Dr. Malilwe did open up with a quote from the digital health strategy, which basically outlines the vision that Zambia, and I want to emphasize Zambia, and not particularly any donor or any implementing partner or any NGO. So we are starting from national documents. So if you look at the digital health strategy, this builds up from the Zambia National Health Strategic Plan, which builds up from Zambia's vision, 2030 vision, which is to become a prosperous middle income nation by 2030. So obviously, when we talk about the healthcare sector, we are then looking at the Zambia National Health Strategic Plan. And then from there, we now get our digital health strategy. So all of this is linked. Everything that we do or that is done through Smartcare is being linked to the mother vision, Vision 2030, to become a prosperous middle income nation. And to achieve that, we all know that one of the key matrices is the health performance of the country, and Smartcare plays a very cardinal role in this regard. As you might know, Smartcare is the national electronic healthcare record system, which has been implemented in Zambia and has been running for about 20 years, currently in deployment in about 1,700 facilities out of roughly 3,400. So slightly over the 50% mark. And we'll sort of share with you also where we're going in terms of those targets. So, and I'm pretty sure all of us here have an idea of an electronic healthcare record system. But in case you are not aware, it's essentially a digital way of tracking, managing, and storing patients' data. The system is hosted locally, so it's owned by the ministry, and all the data that is collected from Smartcare is housed within a government institution called Infratel. Next slide. So in terms of just where we're coming from a policy perspective, we would like to reference a statement made by the former Minister of Health, Honorable Silva T. Masebo, when she was launching Smartcare Pro in Chongwe. And she did talk about how the introduction of Smartcare is going to bring about an elevation of our healthcare infrastructure, essentially pointing to how digital systems are coming on board to support the works that the ministry is doing. And also something that was a very huge milestone in the history of Smartcare. For the first time since its inception, the Ministry of Finance actually allocated a budgetary provision towards the rollout of Smartcare. This was announced in the last speech by the Honorable Minister of Finance. Next slide. So in terms of where we are coming from, and I know many times when I interact with my fellow clinicians, some of them interacted with Smartcare, during the legacy days, others with Smartcare during Smartcare Plus. So sometimes people don't have a full, and why all the fuss around Smartcare Pro. So if we look back the last 22 years that we've been in deployment, and when I say we, I mean as an ecosystem with regards to Smartcare. We came from a system that was a standalone system. So the way Smartcare Legacy was, it was installed on individual computers. Someone had to come install it on your computer. So it was distributed in that sense. You didn't have a centralized architecture. So obviously that came with its own challenges, which meant that each facility needed its own server where all that data would be stored. And obviously there are risks around data storage. It also meant that the system was offline. You couldn't aggregate this data together and be able to have a snapshot of the country's health KPIs within an instance. You needed to then aggregate this data and then build it up to a national perspective for you to be able to speak at a national level. And obviously, as we might be aware, and this is where I guess the stigma of Smartcare being an HIV system comes from, Legacy was quite ART focused. So there was a lot of focus around ART service areas, from your HIV testing to your pharmacy to your PMTCT and the like. And it was missing certain functionalities which are cardinal if you're going to deploy an electronic system at a healthcare facility. So obviously those needs brought about the need to not reinvent the wheel, but take the system to a higher level, and hence came Smartcare Plus. With Smartcare Plus, we had a dual approach. You could access it online or offline. It then introduced that concept of what we call global search, which means if I see a patient in Namushakende, and I refer that patient to UTH, UTH should be able to search their records and be able to find that patient because we are pulling from the same database. And that's what we refer to as global search. In addition to that, it expanded a couple of things regarding service areas, such as IPD was introduced in Smartcare Plus, as well as nursing care, but it still didn't have anything for our colleagues who work in the surgical departments. So then enter Smartcare Pro. With Smartcare Pro, the whole essence, and as you might be aware, this is where the world is going, was to build a system that could run from a central server. Now, this has a lot of advantages, as you can imagine. It means that at any given time, the system is synchronized, it's online, and you can access real-time data. So what this means, and it captures the vision of the government, especially as elucidated in the last speech by the minister, where he talks about we should be able to find a record for a patient who's been seen in a rural area and then transferred to a tertiary facility. So this was made possible by the re-engineering of Smartcare to have a centralized architecture. Obviously, this has its some challenges, but as a country, this is the best way forward for us to be able to keep up with global trends, administer the kind of care that our people need and deserve. In addition to that, we then introduced more clinical features. So the focus with Smartcare Pro has actually been to be very heavy on clinical functionality. In that regard, new features like TB have been introduced, cervical cancer, pharmacy has been enhanced, MCH, we introduced a digital paragraph. You no longer need to print or fill out a physical paragraph. All of this can be done within the system. We built a much more robust inpatient care. You can actually admit patients to a specific bed. You're able to see if a particular bed is full. You can go to a nursing care plan. Obviously, it needs more robust functionality, but you can monitor patients who are receiving blood transfusion. You can monitor patients who are taking certain drugs, so on and so forth. You can do a TPR chart. And we've also built under 5 charts within the system where you're able to track the growth of a child that is under 5. In addition, we also successfully implemented biometrics. The biometric issue was a big one because Before, we couldn't uniquely identify individuals. So meaning if you came to the clinic as John Peary, then the next day you came as John M. Peary, we would register you as two different Johns. And that history that was registered yesterday would be lost. But now with biometrics, all you need to do is come with your fingers and your record will be found. No need to print cards or files. And a lot of clinics have testified to the savings that they're able to make because they no longer need to buy files, they no longer need to print prescription pads, ordering forms for lab investigations, all those stationery that cost something and inevitably drive revenue away from clinical service areas to administrative, have been taken care of in Smartcare Pro. Next slide. Okay, so in this particular section, we just wanted to give you a snapshot of where we are coming from for the last financial year. Sometimes it's helpful to just recap and look at where you're coming from, and obviously that gives you a very good analysis of what else remains to be done. So currently where we stand as of FY24, we managed to implement Smartcare Pro in about 7,766 facilities. And of these, we are targeting to increase this target to 2,043 facilities by the end of FY25. So this target includes both those that have been funded and supported by the US government through CDC and those that have been funded by the Ministry of Finance through Smart Zambia. And this is some of these charts are just showing you the distribution of where we still have paper-based systems, where we still have legacy, where we now have Smartcare Pro, and where we are targeting to go to within this financial year. Within the next financial year, we should be able to reach all healthcare facilities within Zambia. And I think that should be a milestone that every Zambian should be proud of, because this will make us probably the first country in Africa to have reached such a huge milestone regarding implementation of electronic healthcare record systems. Next slide. So also we know that, okay, I'll skip this slide since we've already talked to distribution. You can go to the next one. We know that there have been challenges during this journey. I mean, things that a lot of our institutions have already talked about, challenges to do with network precipitated by power. In this regard, we've been working with providers like Starlink. We've been able to deploy Starlink at facilities. And people who are living in a rural area, as you are driving there, there's actually no network bar on your phone. But once you get to the facility, the people are able to use Smartcare Pro. In addition to Starlink, we're also using other connectivity modalities like APN, GWAN, which is a government-wide area network. And also we are able to combine depending on where the location of the facility is. So this is just to show you the effort that the government is making with its cooperating partners to ensure that wherever the system is deployed, the system is able to be accessed with adequate network. Obviously, this is a work in progress. We know that part of this challenge is due to the frequent power outages that Zambia has been experiencing, because once you lose power, your cell phone tower also drops and you also inevitably lose network. But solutions are on their way and are being implemented as in this particular slide as demonstrated. Next slide. So regarding, I'll skip this slide since we're talking to the same, but regarding also the other challenge which has been there, which is power. We've been implementing backup solutions in some of the in some of the healthcare facilities to ensure that there is no disruption to service, because we know that some of the feedback which has come, which has been hampering uptake, is the frequent power outages. Colleagues, as you might know, this is an issue which is multi-sectorial and requires multiple stakeholders. In this regard, the Ministry of Health, together with other cooperating partners, are working to ensure that power is being implemented. And obviously, as we go along, those updates will be shared with you. Other cooperating partners are also doing the same. And together as an ecosystem, we're trying to see how best we can deploy more cost-efficient solutions that will be easier and cheaper to implement and will still allow our healthcare workers to be able to use the system and provide critical services to their patients. Next slide. So regarding some of the work that we did in terms of clinical functionality for FY24, we were able to develop and implement the TB module, right from TB screening, which we've implemented across all service areas. So this means a patient who's seen in MCH or they're seen in surgery, the system will prompt the user, or at least it will give that opportunity for the user to screen a patient for TB. In addition to that, we've got a full-fledged TB module that captures initial visit, follow-up, and this will be rolled out as an upgrade to all facilities shortly. In addition, on the MCH module, as I already mentioned, we managed to digitize paragraphs. You can now attend to your pregnant clients using a digital paragraph. You don't need to print anything anymore. You can save yourself stationery and use that money to buy medicines or anything else that you need for the client. Smartcare Pro also has a full-fledged antenatal, postnatal, and family planning functionality. We've also been able to implement cervical cancer in terms of being able to screen patients, treat them, and refer them. In terms of the HIV program, I'll speak to particular segments which are of interest. Specifically the biometrics, as I already mentioned, the biometrics give us the capability to deduplicate clients, because one of the biggest challenges we're having were clients with multiple records coming to the facility and we can't tell whose record is who. But now with biometrics, we're able to resolve that. In addition, we've been able to implement the latest PEPFAR MER guidelines within Smartcare Pro, which are the guidelines 2.7. So you're able to, whatever indicators are in 2.7, you will be able to run a report within Smartcare Pro and get those outputs that you need. We've also been able to implement ART provision within the PMTCT module. Before, what needed to happen was you needed to exit the MCH module, go to ART, start the patient on ART there, and then come back.
The screen is not moving.
Okay, Dr. Malilwe, are we good on the screen?
We actually good. There were a couple of people in the chat box that are saying that it's not moving. Perhaps just check your connectivity because there are other people who've confirmed that the screen is moving.
All right, thank you for that. The other things we've been able to work on are integration. So obviously Smartcare exists in an ecosystem of other digital systems, specifically DISA, which is our lab information system, and LMIS, which is pharmaceutical management logistics system. So we've been able to integrate functionally with both of these systems. There are a few tweaks and changes we're making with some of those integrations, but we've tested the integrations. The systems are able to speak to each other. But a few tinkerings are required just to ensure that we are seamless in terms of that integration before national scale up and rollout. In addition, we also introduced an appointment schedule. This is something that had been pending for some time. And there's something exciting we'll be introducing in line with this later on in the year. But suffice to say, currently you're able to schedule appointments, you're able to filter appointments, you're able to look for particular clients who you said, okay, today I wanted this client to come for OPD under 5, and you can screen and check if that client is actually on that scheduled appointment. We've also tested SMS integration so that when clients have an appointment made, they will have an SMS sent to them. So that has been successfully tested. We'll be rolling that out. In addition to that, clients will be able to receive reminders about appointments so that they don't miss some of those critical appointments that they may have. Next slide. So again, very quickly, I'll try and breeze through this one, but just high level in terms of other milestones that we achieved for last year was we expanded our OPD module. You are now able to make diagnosis using ICD-11 and the National Treatment Guidelines. If you use the National Treatment Guidelines, the system will propose to you the nationally adopted treatment guidelines for that particular disease. Now that we have monkeypox, we're able to upload monkeypox into the system. And according to the guidelines that the ministry sets out, it will show you how to treat monkeypox, how to manage it, so that then you're not scratching your head once you are faced with a patient with monkeypox. Surgery, we've implemented a surgical module. This is yet to also undergo an upgrade. We'll be doing an upgrade this year. But currently, you're able to make appointments, book plans for surgery. As I mentioned, we are working on an appointment schedule through which clients will have a mobile app to be able to schedule and make appointments. And at present, we are able to cater for pre-op, intra-op, and post-op modalities. In terms of our medical certification cause of death, you are now able to print a death certificate and a notice of death from Smartcare Pro. Once you register or you designate a certain client as dead or died, you are able to actually print that medical certificate. So obviously this now needs to undergo the necessary processes and the handovers, because part of this is managed by the Department of National Registrations, Death and Records. So once that integration and that synergy is done, then we envision that we will no longer need to print those huge files of death certificates that we used to have or we currently have on the wards. And we can save the government some money in terms of printing all this stationery when it can be generated within the system. When it comes to pharmacy, we will be implementing this year a smart prescribing system where you'll be able to prescribe according to the condition of a patient. So you'll be able to see pediatric patients. You'll be able to see, okay, according to the condition, this client has got allergic rhinitis and they're aged between 5 and 14. This is the recommended treatment according to our national guidelines, and also prescribing according to weight. This is going to be coming up this year. I think I've already touched on inpatient management and digital paragraphs, so I'll skip this. Next slide. Okay, so I'll just talk briefly about some of these slides, but this is what we mean by a centralized architecture. So what you're seeing at the top there is one server, or in simple language, it's a big computer that sits at Infratel. Infratel is the government-owned data warehouse. And from that one big computer is where all the facilities are basically running their instances from. And this allows them to be able to exchange information real time. I can send a request to UTH. I'm sending you a patient for MRI, and they'll be able to get it real time. Next slide. Biometrics, as I've mentioned, this is an example of where we are implementing biometrics. So as you can see, someone comes to the window and we don't even need to ask too many questions. We just say, okay, please put your finger there, and their record is able to be retrieved within the system. And very soon that pile of files that you're seeing there will begin to disappear, because now that file is sitting within the system. Next slide. These are now just dashboards that we've also made available to stakeholders. They are online. Anytime you want to see the progress of Smartcare, for example, in terms of deployment, connectivity, where are we in terms of the number of facilities where we've deployed, where are we in terms of the connectivity, which facilities are connected right now, real time. This is all information you're able to access on your own. You don't need to contact us. You can go online, and we're happy to share the links with you so that you'll be able to check on the status of your particular facility or any facility of interest to you. Next slide. We've also deployed a training dashboard, which just shows the number of healthcare workers cumulatively that we've trained. So currently we are seated at close, just shy of 20,000 healthcare workers that have been trained within to use Smartcare Pro. So this is a very huge, significant number, colleagues. And we believe over time that this number should hit close to 100,000, by which which point the system should be at a national level in terms of deployment. Our knowledge rate currently sits at 86%. But again, the whole reason behind this slide is just to show you that some of this information is now available for anyone to go online, check. And if you want, you can even do a research on any area of interest regarding some of these information outputs that are coming from Smartcare. Next slide. All right, so at this point, I will ask my colleague Paul to give us some updates regarding data and reporting, just so that you are adequately abreast with updates on that side. Paul, over to you, sir.
Thank you, Dr. Sam, and good afternoon, everybody. So to just cement on where Dr. Sam left off, in terms of the dashboards that are existing, they obviously provide us an insight in terms of how the system is performing. But apart from that, in terms of ensuring data quality, I see there's a question that was just recently posted in the chat. How do we ensure that then the data is of good quality since it's a centralized architecture? The system comes with quality control and quality assurance measures to the extent that you cannot proceed to the next level without making certain key entries in particular fields. So let's take, for instance, you cannot proceed to go towards dispensing medicine without a prescription that is aligned to that particular dispensation. So this way will ensure completeness of data on the prescription side, but as well as the dispensation side. So the system also then provides you reports that you can access on the front end. Not only HIV-related reports, but overall. Recently, we did release the HIA3, which is very cardinal at hospital level, that then would be utilized for reporting. We'll be able to share that in the chat. I am seeing somebody indicating that I am not audible. Is that the case? I just want to confirm.
I can hear you clearly.
Okay, perfect. I presume then it's the network. So like I was indicating, the system provides you the clinical reports that then you can utilize at facility level. So not only the HIA3, you could actually utilize the HIA2 as well as HIA1, A and B. And these ones are developed in alignment with the current enhancements of the report. So as and when the Ministry of Health releases an updated version, then we'll equally create and update the version which would be in Smartcare. But the ones that we currently have right now is the current version that exists. We will be receiving the next update from the ministry, and then once that is released, we'll go ahead in updating the reports that are existent in the system. Now, from the health informatics side, the question has always been, yes, we have the system. Yes, we are attending to clients in the facilities. How then do we go about in terms of utilization of this data? So one of which is, of course, the clinical practice reports that you access. But now you have data that is available in the National Data Warehouse, which speaks towards you utilizing it for research and any other clinical decision making that would be required to generate insights from that data. So we have created a data access portal that once you are cleared by the Ministry of Health, that is the Department of ICT as well as M&E, clears you that indeed you can access patient level data. You would be given credentials to go toward the data access portal where you can easily download a data set with the variables of interest. Then you can go about analyzing and conducting your study. So this then reduces the burden of actually conducting research in terms of data collection, as data is already available in the National Data Warehouse. So there is just that process of ensuring that there's clearance from the ministry, and then you can easily access your records in that regard. So lastly, on my side, in terms of the data, we are then moving forward in this particular year to work with various programmatic teams in ensuring that each program, in as much as they have the clinical functionality in the system, they are going to have access to their reports. So let's take, for instance, the functionality around tuberculosis. We'll look at what are the corresponding reports that the TB program would require. If we talk about cervical cancer functionalities, what are some of the reports that are then going to be required for that particular programmatic team? So this is going to be done in a phased approach, program by program, in order to ensure that then not only do you have the clinical functionality, but you also have your relevant reports that you can then utilize either on a weekly or monthly or quarterly reporting that you do. So this could be line listing at patient level, or it could be aggregated data, but obviously this is tailored based on the program and what they actually need. So there's that constant engagement with the program to say what is it that you need in terms of the report, and that is what would then utilize to build the report. If at all the reports already exist, it's just a matter of embedding them into the system. If they do not, then we gladly sit with the program team to derive these parameters and put together the useful for the program. Thanks and all.
All right. Malira, you can go back to the slide, the slide before this one. Yes, please. Thank you. All right. Thank you so much, Paul. So those are some of the updates that we have for our colleagues in the M&E and data management space. Then in terms of plans for our clinical features for this financial year, what you can expect, we'll be introducing a billing and administration module this year. This has been a request from especially the big facilities, as they need some sort of digital system just to manage their facility and be able to administer it well. When the SMS or the facility head walks in, she wants to be able to have a dashboard where she can see how many patients did we see yesterday, who reported for duty, how many people did we have in these areas. And it even gives you now a platform to be able to request objectively to, if you need additional healthcare workers, okay, look at our data. We are servicing so many client visits per day. So that's a module that's coming up for this financial year. Another module that we'll be introducing is dental. And basically, this is just to support our colleagues that work in the dental department. In addition, we'll be looking at physiotherapy, and also we'll be expanding the surgery module just to make it more robust. And essentially just allow for everything that happens within a big facility like Kitwe Teaching Hospital, or UTH, or Livingstone General Hospital to be captured and to be managed within Smartcare Pro. So these are some of the big clinical features that we are looking to release for this coming financial year. Next slide. All right. So in terms of just a snapshot when it comes to deployment, so this just shows you where we are currently. As I had mentioned, we implemented Smartcare Pro in about 700 plus facilities. And that's the same number that we've currently started with. Starting from quarter two, which is this quarter, we are looking to add an additional 443, pushing the total number to 1,200. And then quarter three, we'll add an additional 400, which will push it to 1,600. Now, these are the ones that are coming in through our CDC, but we also have the ones that will be sponsored by Smart Zambia, which are a total of 1,200. So by the end of this year, we should have Smartcare Pro operational in over 2,000 facilities. And obviously, this pushes us closer to that target of being able to reach all 3,400 healthcare facilities. So at this point, colleagues, we come to the end of our presentation. Thank you so much for your attentiveness. I will now hand it back to our moderator, Dr. Malilwe, for the next segment of the program. Thank you.
Thank you so much, Sam. It has been a good presentation, and you've been on time. And I know the chat box is buzzing with lots of questions, and thank you for that. You're attending to most of the questions there. Sam, this has been a good presentation. I was hoping you were going to tell the people that, you see, Smartcare Pro actually looks prettier than Smartcare Legacy, because I know there are colleagues that are really trying to stick to Legacy.
Yeah.
But in terms of the user interface with Smartcare Pro, you actually open it up, it actually looks like we are in 2025 and we are not in 1982. And but Sam, before we take some questions from the chat box, and colleagues, if you want to make a comment, please raise your hand, or indeed put it in the chat box. We'll get to it. We have about 45 minutes for us to be able to discuss things around Smartcare Pro. I was also hoping you would mention something on the data migration, Sam, because I think this has been a thorn, especially for us that are eagerly waiting to be able to access and use the power of Smartcare Pro. Where are we, whether it's you or it's Paul, sorry to preempt the discussion, but where are we with the data migration?
Okay, all right. Thank you so much, Dr. Malilwe. So I'll tackle the first one and then I'll allow Paul and Lisa also please feel free to come in. I know we also have Timothy on the call at any point. So in terms of, yes, usability, as Dr. Malilwe has mentioned, if you've looked at SmartCare Pro, we've really improved the look and feel. It's very intuitive. Even colleagues who say we need to be trained, usually, I mean, if you just give it 2, 3, 5, 10 minutes, you're able to navigate and find your way around. And also happy to have people express interest and we can register them. Then in terms of data migration, I'll ask my colleague Paul to come in and just give guidance on that one. Thank you.
Thanks, Doc. So I'll give an update in terms of the data migration, and I think I'll provide a background as to where we're coming from to reach this particular extent. One of the reasons as to why we've actually gone towards utilizing SmartCare Pro is the data aspect. One, which is data security. When you look at the previous systems, SmartCare Pro, SmartCare Legacy, as well as SmartCare Plus, you notice that it was relying on a server that was located within the confines of the health facility. Now, the risk that you have with data that is localized is you have numerous individuals that will plug in a number of flash drives and the like into that particular server. If you come from Luapula, you would actually note a number of cases where we've had the server being hit by lightning, and that caused loss of data at facility level. And in ensuring that then we're able to provide data back to the facility, we had to restore data from the national data warehouse. Now, at some times, if this data did not stream to the central server, that means that there will be loss of data because there's no data to come down from the NDW to the facility level. So there was that pain point with regards to that. And that is why we moved into the new system. But obviously, knowing that as we move into the new system, we want to have access to the historical records. And then you identify that there's a difference in the way SmartCare Pro is built. For instance, the example that I gave, you cannot move ahead in terms of dispensing a drug which doesn't have a prescription. And yet the previous systems were allowing that, where you can have an individual who doesn't have a prescription and yet they have a dispensation. Or if at all it is in the HIV space, you know that for you to actually dispense ART drugs, you need to ensure that an individual is actually having an HIV test result. Now, with the previous system, you find that a test result is missing, but this is an individual who is actually on DTG. So there was a gap in terms of completeness and the quality of data. So for us to ensure decision-making is being made on quality data, we had to improve the structures onto which data should be coming from. So now, in terms of the migration, what we've been doing is looking at the records that are coming from the previous historical systems. Then we look at what do we need to change. So we start by looking at if at all an individual is having a missing first name or last name, therefore we need to flag them and then change that. We wanted to do that. For instance, even an NRC, like someone has just popped to say if an individual is having a missing NRC, how then do we move forward? We wanted to do that at the central level, then realized that some of these records cannot be automated in terms of just plugging in, because there are sometimes we wouldn't know at central level when somebody tested positive, or we wouldn't know when somebody actually was tested for tuberculosis and things like that. This data needed to be cleaned at facility level. So we did share lists to the facilities to ensure that then you can target those clients and update those records to ensure that then as we move into the new system, those records are complete. And we did receive recently, I think a couple of weeks ago, we did receive the cleaned up data sets to say these are clients with records that have been cleaned. We can now move ahead in terms of loading. So we're currently looking at then loading this particular data And this is Smartcare Plus data into Smartcare Pro, so that then colleagues that are using Smartcare Pro can access the historical records. But what we did in the interim was to ensure that client profiles are already loaded. So even as we speak today, somebody can walk into a Smartcare Pro facility and access their historical Smartcare Plus profiles while they are awaiting for the other interactions such as pharmacy and clinical interactions to be uploaded, but wanted to ensure that there's no duplicate record that will be created in the system by profiles being available. So that is currently being done, and we're looking at it being completed within the next 2 weeks. And then we're going to wrap up the entire migration process of Smartcare Plus data into Smartcare Pro. Now, that is on the plus side. On the Smartcare legacy data, we migrated that data last year. The first set of it was migrated from Smartcare legacy, the first 400 facilities that we moved into. And what then remains is to ensure that we cover up the gap in between when the data dump from those facilities were collected up to when the data was actually loaded. So it's just a matter of updating the remaining records. And that is where we currently sit. So then what is the implication of this? The implication as of now is that you could still provide services because then you can still search for the client that you had in Smartcare Plus, that you had in Smartcare Legacy, and attend to them. Number two is that on the reporting side, you will be unable to see the HIV reports, you'll be unable to see those clients because then the clinical interactions and records haven't been loaded yet. Up until we load them, things such as the QA/QI report, ART register, and PEPFAR MER wouldn't really populate those. So that's the implication of this particular migration status, and that is for Smartcare Plus to Smartcare Pro. For those that were migrated from legacy to Smartcare Pro, by virtue of all those records being moved, you are able to see those clients, attend to them, as well as access them on the reports, all the key reports that you're able to access on Smartcare Pro. Those clients would actually be accessed. Thanks.
Thank you, Paul. And, I saw that you answered Dr. Choka's question in the chat box about global search, but just clarify what you mean. The global search, is it only in Smartcare Pro or Smartcare Plus also uses the global search function?
Hi, Doc. So, of course, the global search implementation was available in Smartcare Plus, but it had its own gaps because it was depending on the data that is sitting at the facility server to go to the central server for you to ensure that you can search for a client anywhere they are. But that's no longer the case with Smartcare Pro because all the data from all the facilities is going into just one server. So let's safely say all the records are going into one pool. So as you search the global search, then you're simply searching, all the facilities will be searching within one pool and you can easily access those records, unlike the previous implementation, which was in Smartcare Plus. And that's where the difference really comes in. So in terms of actually even tracking a client's movement from facility A to facility B, it is now enhanced as you utilize Smartcare Pro because everybody is found within the same pool. The only difference is that they have got different tags on the facility, their parental facility where they are coming from. So this way, it makes it better in terms of tracking of clients, unlike waiting for that connection of records to move from a facility server into a central server, as was the previous case. So this implementation in Smartcare Pro definitely is a game changer around tracking clients as they revolve around numerous facilities. Thanks.
All right, thank you for that. Sam, back to you. Dr. Onoya is asking about confidentiality of these files because, as you're making it sound that anybody who has access is able to search for a client and be able to look through files. So he's asking what we've done to just, reinforce confidentiality, especially for many, many clients around the country.
All right, thank you. Thank you for that question. Very, very valid question. And I think anyone who's been a patient, which I believe we all have been, it's something that's always at the back of mind. Who has access to my data? So when it comes to looking at data security, we start from the level of where the data is being stored, right? So currently, as I mentioned, all data that Smartcare collects is stored at national level at Infratel, which is a national data warehouse. Then when it comes to accessibility at facility level, when a person is signing up to be a user of SmartCare, they will be given access to areas that pertain to their service area. So for example, if I sign up as a registry clerk, right, and I need my role is to receive patients, search for them in the system, and then refer them to triage, I cannot look up any confidential patient details. I won't be able to see any of their last lab results. I won't be able to see anything that is clinical. So that's how the system has also been created to ensure that people then don't have access to information that they shouldn't have access to. So within the system, actually, if you are a facility administrator, you are able to assign. So if you feel that this person at this facility only needs to see this information, you can designate and say, okay, since you're working in VCT, you only see triage, vitals, and only data relating to VCT, and that's it. So those are some of the things that we've put in place to ensure that only the right people are able to access the right information. Thank you.
Thank you so much. Mr. Timothy, I think Timothy is connected. Timothy, I wanted you to make some comments on training. The number of comments in the chat box. How can we get involved in Smartcare Pro? How do you train people? Do you have any mechanisms of follow-up to make sure that people are actually using the system the way they're supposed to? Timothy.
Thanks for that question, and it's a privilege to be on this platform to share insights around Care Pro. So in terms of capacity building, our strategy is three-phased. We do what we call pre-training, which, for example, all the sites that has been transitioned, we had to collect data on staff, also data on the different service points, which then was used to inform the type of training which that facility had to receive. So we adapt the trainings based on the size of the facility, but also the number of people and the distribution of the different cadres that are in that particular site. So in so doing, we have a team of healthcare workers who are trained, doctors, nurses, lab people, pharmacy, everyone. So these are the teams that we send out to go and train their colleagues. So we have, let's say for facility A, let's say Challenger, for example, which is a big facility. So you'll see that the team of trainers will be in a facility maybe for 2 weeks. And in the first week, they'll focus on classroom trainings where they give a system overview and also speak to the specific modules with respect to the participants that are there. Then after the classroom training, we do what we call on-the-job training, where now you work with the staff as the clients are coming through to receive their services. Beyond that, there's what we call the post-training support. So every facility where there's Care Pro has a team of champions who are facility-based, and these champions are equipped with basic troubleshooting skills and just equipped further in terms of skill sets to provide that mentorship that is required for new staff that are coming in, but also for every other person within the facility who is having challenges. In addition to that, we have videos, we have job aids, and we just have this thing we call the kit, post-training kit, that has videos, job aids, and everyone can have access to those as they do their work or if they want to have a refresher. And we also create WhatsApp groups. So currently we have the national WhatsApp group, we have facility-based WhatsApp groups, where if someone is having an issue, they can post it there and the peers will be able to respond. If it's something that requires service desk attention, then that is escalated to the service desk. So in a nutshell, that's how the training or capacity building is structured. Thank you.
Thank you so much, Timothy. Yeah, well elaborated. And Lisa, being the engagement specialist, how do you envision Smartcare Pro being used in private facilities? I have seen some comments in the chat box of colleagues from the private sector that are asking how they can get involved and be able to, tap into Smartcare Pro and be able to use the system. And what are some of the benefits that you envision for private facilities to actually jump on board and be able to use Smartcare Pro? Lisa.
Thank you for that question, Doc. Apologies for that. And good afternoon to everyone. Very interesting question. We have actually had some facilities get transitioned to Smartcare Pro private entities. It's a very straightforward process. I'm sure those that might be online that have been transitioned can vouch for that. Literally, all it takes is just the facility, anyone from the facility administration reaching out to us, advising when they're available for a meet-up. We have online sessions with them just to basically outline what they need to have ready prior to transition. How the costs look dependent on their facility sizes. So basically any information that they might require to help them with the transition. So far, if I'm not mistaken, we have about 4 private facilities, one in Central Province, one on the Copper Belt, and 2 in Lusaka that have transitioned. And we also have had interest from Morning Star Clinic and Bread of Life Clinic very recently that have reached out to us. And Telno Clinic as well, that have reached out to us interested in transitioning their facilities. Obviously, one of the main benefits is, unlike the systems that they're already using, which have to be licensed and they will then need to make payment on a frequent basis. With Smartcare, none of that. This is a locally grown system. It's a system for Zambians by Zambians. So it's obviously going to be something that once you transition is really that's the only cost you're going to incur. So basically it's ensuring that the equipment at the site has been procured, and also your staff have been trained. That's literally the only cost you're going to incur, pre-transitioning. Once you have transitioned, you have no costs that you're going to incur as a facility. So basically, that's one of the main advantages. Another key advantage just off the top of my head is the fact that we really want to ensure that clients, irrespective of where they go, are able to have some sort of access to their historical records, correct? So if we ensure that every facility in Zambia is actually transitioned, irrespective of whether it's a private facility or a public facility, we then literally give these clients their data at their fingertips. So that is also another key, key advantage to the system, and definitely something that should encourage our private entities to transition. At the moment, one of the hindrances to the transition, I'm sure you heard Dr. Sariri speak to this earlier, is we do not yet have a billing module in the system. It's something that is being worked on. So obviously for the private facilities, the billing component is something that's very cardinal, but it's something that's definitely in the works, and we do expect to have it up and running within the next couple of months. So once that happens, we really see no reason why any facility within the Zambian landscape should be using a privately procured system. Thank you, Doc.
Thank you so much, Lisa. And that definitely does make a lot of sense. You can imagine you move from private facility and you go to a government facility, or vice versa. You go to another private facility and they start to take history from the beginning. So it's always good to have that continuity of care. Chimwemwe, I see your hand is raised. You can unmute and either ask a question or make your comment. Chimwemwe.
Sorry, Doc, maybe just as Chimwemwe is coming on, I know earlier Paul had mentioned that we will share the HIA3 summary report. Unfortunately, I realized because of your rights on the group, I do not have access to actually share that, but I have sent it to you via WhatsApp. So probably it's something that you could share with the colleagues in the chat.
Right, noted, Lisa. Chimwemwe. Maguni, I see your hand. Chimwemwe, you can make your comment, and then we'll have Maguni speak, and then Dr. Wupe. Chimwemwe,
Okay.
are you?
Are you able to hear me?
Yes, now we can hear you.
All right. Yeah, sorry about that. So thank you very much. So my question was around reports in the Smartcare. So I was just saying that I'm happy to see how much progress has been made, and my area of interest mainly is MCH, just to find out if we have reports for MCH in Smartcare Pro, so that we can really realize full utilization of the system. Yeah, so those are my comments, and thank you for the presentation.
Thank you so much, Chimwemwe. The team has taken note. Maguni Siatontola, you can go ahead, unmute and give your comment.
All right, thank you for the time. I have two questions. My first question is, will Smartcare Pro be merged or linked with ELMIS? Like when you dispense drugs using Smartcare, will that also consume drugs in ELMIS? Then the other question is, there's someone who had asked the question on confidentiality issues. Then the response was facility admins are the ones that are going to be issuing out rights. So now, does it mean that an admin from Shangombo will be able to view files for people from Livingstone? And if yes, will that not be a breach of confidentiality? Thank you.
Thank you so much, Maguni, for your questions. Part of the issue with ELMIS is technically, I think the integration has happened, but it's just a matter of scale up. Dr. Wupe, and then we can get some responses from the IHM team. Dr. Wupe.
Thank you, and thank you for the presentation. My concern mainly is on the pediatric clients, especially when it comes to dosing for the drugs. So we've actually raised this before. Most of the times we'd have to go on to the adult side of dispensation and try to adjust to the pediatric wise, but of course this doesn't reflect well when you finally look at the system. So I wanted to know if this will be dealt with appropriately in Smartcare Pro. Thank you.
Thank you so much, Dr. Wupe, pediatrician. I noticed that people are definitely asking the questions that they find as pain points. Dr. Sam, who would you say is best placed to take some of these questions?
Okay, there were quite a number, so I think you will help me with the themes. But let me start with the one regarding pediatric dosing. So yes, Dr. Wupe, if I got the name correct, we are currently working on an upgrade of our pharmacy module, which allows you to specify dosing for the children. But even in the current implementation, you're still able to pick a dose that is pediatric in nature. So for example, I'm just using this as an example. If an adult dose of paracetamol is 1,000 milligrams, and then you want 125 milligrams, as long as it is a drug which is registered with ZAMSA and the ministry, it is there in Smartcare. So you should be able to access that. But for the full sort of use case, to be able to modify dosing for clients, to get weight-based dosing, we have an upgrade that will be coming up later this year to fully address that need. Dr. Muma, I think for the others, you may need to give me just an overview of who said what, then I can,
Yeah,
Actually,
Dr. Chimwemwe was actually, asking, very passionate about MCH. She wants to know, the reports now, are we able to generate reports?
Oh, okay. Yes. Okay, that one is Paul. I think Paul can take that one.
Yeah, thanks. So just quickly respond for the MCH related reports. We have taken strides around that work, and we have ensured that we've deployed at least 3 MCH related reports. As we speak right now, you can log into Smartcare Pro and access the immunization register, which is live. You could also access the antenatal as well as postnatal care registers. So out of all the MCH reports, we are then moving towards ensuring we add as many reports as we can, but it is with a strategy of ensuring that we have some form of consolidated reports, unlike the numerous segmented hard copy registers that currently exist. We are looking at how best do we then put together some of these segmented reports, unlike really them being separated. So yes, MCH reports are available in Smartcare Pro. You can access the immunization, ANC, and PNC registers, but that's not just the end of it. We will be working, like I indicated, we will be working closely with the programs, so the MCH program, around then looking at the current existing templates. Can we merge some of those templates into one particular report, and then we go ahead in developing that report and it being embedded within the system. So we'll be engaging with the various teams and just ensuring that then we are putting our heads together also on how we can reduce the burden of reporting on that end as well. Thanks.
Thank you so much, Paul, for your response. And I hope it suffices, Dr. Chimwemwe. The reports are present, but continuous engagement with the IHM team so that you can zero in and narrow down on specific areas that you may find quite interesting and quite useful. Mahuni is worried that an admin that's stationed in Shangombo is able to search remotely, or global search as it were, for clients that are either from Livingston or even from Lusaka. So he's asking, what control measures do we have for administrators in different areas? Are they still able to access records, or they'll be sort of, limited to a geographic area? I think this question is still talking about confidentiality. So Sam, what's your comment?
Yes, thank you so much for that question. I think I've seen it come up a number of times. So there are a couple of things that we've put in place, and obviously there is more that we'll be implementing just around confidentiality and data security. So I already talked about the current storage of the data, and also that, so when we onboard a facility, we make someone who is the facility manager for that facility. We don't make them the facility manager for all facilities, right? So what they're then able to do is that they can choose who sees what aspects of Smartcare, okay? So that's on one side, right? On the other side is that we also have an audit trail, right? In that we can view and see, or the system is able to ping, or if I can use the word, or access, okay? And obviously from that perspective, those things can then be managed to then say, okay, there was an attempt made by this person to sort of access that, because this is digitized. Everything that is happening is leaving a digital file. So what we have then in place is that we've got that process where the facility manager is managing their facility, not all facilities. In addition to that, they can give access to certain areas in that particular facility. They can give, for example, if you're facility manager for Mazabuka, you can't give for Chongwe District Health Hospital. You can only do it at your facility. And then in addition to that, there are obviously those audit trails that then would allow for management of some of those use cases. And obviously, as we go on, we will be strengthening this particular aspect just so that patient confidentiality is maintained. And really, if you compare, right, with what our current scenario right now is, if you go to a clinic now where they're keeping patient records, pretty much anyone can access those records if you just walk into registries. So as it is, we are probably in a worse off case with paper files, because those files go missing. Someone can come in, get that file, than we are with digital records, because we can track. There's an audit trail, and obviously access can then be restricted to particular facilities. And then more will also be coming up. The more we obviously engage with you, our colleagues who are in the field, who can see these different use cases, you then give us that feedback, and then we're able to strengthen on some of those aspects. I hope that addresses that particular question. Thank you.
Thank you so much, Sam and the team. And you know, just to I saw a comment in the chat box that was talking about usage of Smartcare, right? Many facilities that have had Smartcare Plus have noted that some staff are not using the system. And colleagues, we saw the memo from the Permanent Secretary of the Ministry of Health urging everybody to be able to use the system. And I think the presentation has really outlined the benefits and the importance to us and the patients that we see for us to use the system. You can imagine many of us who have gone to health facilities, you went to maybe Levy 3 years ago, and you go again, and you find you have to open a new file. In fact, 3 years ago is probably even a long time. There are some instances where you go to a facility a month later and you have to open another file. So usually those issues have been, so it really is just to encourage the team that we are the ones who are supposed to use the system. You know, everything rises and falls on leadership, and I understand that some of the leaders are actually connected here. Sam, you have your hand raised.
Yes, Doc. I wanted to just respond to Philip. I think he was clarifying Dr. Wiltomson's question. Philip, if you're referring to, so for clarity, I believe what you're referring to is the lack of drug formulations and strengths for children, right? I believe that's the clarification you're making. Maybe if you could just confirm before I respond.
So it's not necessarily the lack of them. So I think most users find it easier to use adult formulations to dispense to children.
Okay, all right. So is the question that you would like more pediatric formulations?
So currently, I think there are more pediatric formulations coming in. So I think we always wait for that drug list from ZAMSA to verify what drugs are going to be included. So
yeah, okay.
Yeah.
Okay. All right. Okay. All right. So I was just going to respond to say that so the drug catalog we consumed in Smartcare came from ZAMSA and the ministry. So that's currently what we've consumed. But we're also able to create formulations once there is a need for that formulation. So, for example, if the drug catalog that we have didn't have, let's say, pediatric dosing of amoxicillin, we can create that dosing and you will be able to see it within a few minutes on your end. So if there is such an instance where you can't access certain formulations or strengths, please do share those formulations and strengths with us, and then we'll be happy to upload those on the back end of the system. Thank you.
Thank you so much. Paul, there's a question in the chat box. What happens with duplicates that count twice or more when generating reports in Smartcare Pro as compared to legacy?
Hi, Doc. Thanks. Two answers really. First of all, I would like to get context to the question. What happens with duplicates that count twice or more when generating reports in Smartcare Pro as compared to the legacy? I'll highlight that from the data migration perspective, we are accounting for the duplicates by ensuring that then we deduplicate those particular records so that then by the time you run your reports, you're going to have a line listing which is unique because then it will only account for a client record which is on a particular profile. So there's no way you're going to have the same records on two different profiles. It's just, it can only be one profile that you log in for one client and then you update that particular record, and that's when they do appear. But I think I can engage further with the colleagues in the chat to just see if at all there is a particular context to it. But that is how we are addressing any chance of duplicates in that regard. So yes, you could have duplicates in terms of first name, last name, and the like. But in terms of you running your reports, when you actually run them, it will pick on the profile which is having the records or the interactions that are there in. And that's a client that you'll actually be able to see on your respective reports in Smartcare Pro, that is. Thank you.
Thank you so much, Paul. Please also respond to Livuyu in the chat box. They are really asking about those clients that have a file in every district. And do you need to re-register them? How can we curb such? So just you can respond to that in the chat box. PK, your hand is up.
Oh, hello, good afternoon. That was a very great presentation. So I think my quick addition is just in regards to confidentiality. It seems like there's quite a number of people are anxious about, maybe admin staff having access to every single record, maybe on that patient. And Dr. Sam said that the admin staff will have more kind of like a restricted kind of like access to the admin staff. So I would just like to make mention that probably that has to be the downside of things, because if we are looking at continuation of care, then definitely yes, the admin staff, they need to have access to their admin bits in order for them to do their work properly. So at the end of the day, we just have to believe that everyone is working in good faith and they're using the data for the intended purpose, which means whatever they come across, they know that they are supposed to be very confidential and it's work literally. So yeah, so that's one thing probably which will get used down the line to other providers having access to even our records, because we like Dr. Sam said, we are all patients at some point in life. So yeah, so we just need to believe, and I believe there's a caution during training for everyone in regards to confidentiality, because you might come across someone that you know, and as it is at the moment, we are in a faraway situation in regards to the paper-based records, because anyone can have access, can gain access to it. So I think this would do us more good than harm. That the confidentiality part might be the downside of things, but as everybody just, gets used to how the system works and understand what they're supposed to use the data they have access to, yeah, then it'll all be good, I believe. Thank you.
Thank you so much for your comments, PK. And I'm sure Sam will probably be able to. You want to respond now, Sam?
Yeah, no, I think PK really summarized it very well. I was actually thinking of that point. So if we go back before we had this current implementation, one of the biggest pain points was we can't see patients from other facilities, or if this patient has been to another facility, we can't access those records. They've come here, but they're telling you, no, I went to Kanyama, I went to UTH, so you don't have those records. So then we implemented the solution, and now obviously people are worried that we have access to too many records. So I do think that there is that balancing act, because access to one aspect that was being asked for, this is something that was really strongly demanded for, that people should have access to global search, as it was being called then, brings this aspect. But obviously, like I mentioned, there are strategies to make sure that patient confidentiality is maintained. So first of all, if you're not a healthcare worker, you will not see healthcare data. All healthcare workers, by virtue of our registration, we do ascribe to those laws, principles of confidentiality that we need to abide to, right? Then obviously, from a system perspective, facility managers only manage their facility, and then audit trails as well, to ensure that if someone keeps requesting information from other facilities, those audit trails will be there, and then that person can be followed up to say, okay, why are you looking for? But in addition to that, we can definitely implement more, only that it may now impede on that functionality of global search. But again, happy to maybe in a different forum just sort of build consensus around one particular implementation that will be able to please the majority of the stakeholders. I just give that background to show you that this was a feature that was being requested for a very long time. But now, obviously, once it's there, then there is now obviously that concern, which is valid. But it will be important that we have that consensus around the implementation of what people would like to see, given the capabilities of our centralized system. So I just thought to add that quickly. But yeah, PK really summarized what I was going to say very well. Thank you.
Thank you so much, Sam. And dear colleagues, we have about 7 minutes to 4 p.m. And I think at this point, I want to just get some final thoughts and remarks from the team from IHM. It has been a really informative session. We had really good attendance. We reached almost 600. And that's really, really good attendance. It shows that colleagues are really, really interested in the EHR systems. Paul, just take note of Smart Zulu's question and be able to quickly respond to it in the chat box, as the other colleagues will be giving their final thoughts. So we'll start with Timothy. Timothy, any final thoughts in about a minute? And then Lisa will give her final thoughts, and then Paul, you give your final thoughts, and we'll close it off with Sam giving final thoughts. So Timothy, some final thoughts?
It's just to say thank you to the team for all the questions, and for other gray areas that we may not have answered, please feel free to reach out. We'll be happy to respond. Thank you so much.
Thank you so much, Timothy. Lisa, what are some of your...
Thank you, Doc. Thank you so much for this invitation. We really do appreciate being given a platform to just really scream about Smartcare Pro very loudly. But also just to echo, if there are any additional questions, please feel free to reach out to us at any moment. If you'd like any additional information, we're available to answer your questions. But also, this system will only get better if we are actually using it and giving feedback. So also just ensuring that we are making use of the service desk, which is there to record your incidents, so we know where we need to improve. If you don't tell us, we don't know, because you are the end user. So please, let's make use of the service desk. Thank you.
Lisa, how do they get to the service desk? Is there a number that they can call? Is there an email that they can reach out to?
So there's a toll-free number, it's 8080, that you should be able to reach from all networks. For those of you that on the Care Pro group, if you're experiencing any challenges, the WhatsApp group, if you're experiencing any challenges reaching that line, then you can still communicate on the Care Pro group and we'll provide alternatives. But the best way to reach us is using 8080.
Is this number available 24/7 or there are specific hours?
So currently it's available from 8 to 5, but we are working on having a 24/7 service desk available. So over time you will see some changes being announced, but currently we have our team available for everyone from 8 to 5.
Thank you so much, Lisa. We've really tapped into your expertise. Paul, what are some of your closing remarks, final thoughts?
First of all, it's sincere gratitude for the opportunity to just provide an update on the Smartcare Pro. Well, from my end, when we look at the data, you're looking at usability of the system and how relevant it is. The system is here to ensure that then you can make decisions even at facility level based on data. In this time and age, if at all you cannot make your decisions based on quality data that you can utilize, then you would actually not be leading your teams in the right directions. So let us ensure that then we're able to push not only ourselves, but our colleagues, our teams in our respective spaces, that we can only reach a point of satisfaction when everybody is utilizing the system, but not only that, when we can make decisions from the data that is being derived from the system. So it is here for us. The system is not just for ART or HIV services. It cuts across the various modules that we can actually leverage on. So I would employ everybody on the call that let's be the champions ourselves in utilizing digital systems. The world is digital. So it's either you're going to move with it or you remain behind, because where we are right now is a point where we move with digitalization. And this is a platform where we move with the global trends of digitizing all our processes. So let's move away from paper. Let's embrace electronic systems. Let's embrace making decisions based on data coming from the system itself. Thank you so much.
Thank you so much, Paul, and thank you for your availability. You can be quite busy, especially that you're leading a mammoth task. Sam.
All right, thank you, Dr. Malilwe. For me, again, just I can't add much to what my colleagues have said. I think very poignant observations and comments. Mine is just to thank you all so much. We are very grateful that you could find an hour 30 minutes to come and spend with us. So thank you so much. For those that did not get a response to their question, I have posted my email address. In case you want to reach out, you can reach out, or even to our help desk. You can reach out either way. So thank you so much to everyone, and thank you so much, Dr. Malilwe, for hosting us. We look forward to coming back again.
All right. And so, dear colleagues, that wraps up today's presentation. We were looking at the Smartcare Pro updates. We saw how we started off from about 2003 with Smartcare legacy systems, offline system that really was just at a facility. And we moved on to Smartcare Plus. We saw some benefits with Smartcare Plus. And now we are in the era of the Smartcare Pro, and Pro really just to mean that we are moving with the times. And the encouragement really is that this system only gets better when we use the system. And that's how the team at IHM gets feedback. We use the system, we continue to use the system. Remember that everything rises and falls on leadership. And many of you are leaders in your respective facilities. And we hope and expect that you be the champions of using the system so that, continuity of care is, smooth, and we can be able to be in the present and not in the past where we continue to use paper-based. I have been your facilitator, Malibe Muhuma, with the Lusaka Provincial Health Office. Next week, we'll be looking at another Smartcare topic, and this time we'll be looking at healthcare worker experiences and some of the best practices using Smartcare. So please do join us next week. We thank you that you were able to spare some time today. Great participation, and you were all involved, and we are really grateful for your time. Without further ado, I want to just wish you a pleasant rest of the day and that rest of the week. We'll meet again next week. We'll be looking at, again, healthcare worker experiences and best practices using Smartcare. Thank you so much for your time. I think we'll be signing out now.
Thank you.
All right. Thanks. Thanks, everyone. Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Signing off.